Hello, and welcome to today's presentation on the Access Occupational and Physical Therapy Services. These materials are designed for the Access Fee-for-Service programs, including the American Indian Health Program, TRIBAs, and Tribal Altex. And before we begin, it's important to note that the Access Speech Therapy Services will be outlined in a separate video. All right, so let us begin. Access covers occupational therapy, physical therapy, and speech therapy services that are ordered by a primary care provider or attending physician for fee-for-service members. These services must be provided by or under the direct supervision of a licensed therapist, as noted in the Access Medical Policy Manual, known as the AMPM. Therapy visit limitations apply as described in the AMPM, regardless of enrollment changes throughout the benefit year. All right, so let's talk specifically about occupational therapy. Access covers medically necessary OT services provided to all members who are receiving inpatient care at a hospital, nursing facility, and custodial care facility when services are ordered by the member's PCP or attending physician. Inpatient OT consists of evaluation and therapy. Outpatient OT services are an access-covered benefit when medically necessary, as described below. Outpatient OT services are covered for all Altex members and members under the age of 21 when medically necessary. And outpatient OT services are covered for acute members 21 years of age and older. OT services must be provided by a qualified occupational therapist or by a qualified individual under the supervision of an occupational therapist within their scope of practice and consistent with the ARS Title 32, Chapter 34, and Arizona Department of Health Services Administrative Rules for Arizona Administrative Code Chapter 43. This screen offers a list of services that are included in the occupational therapy services. However, this is not an all-inclusive list. Now let's talk about physical therapy. Access covers medically necessary PT services for members in an inpatient or outpatient setting when services are ordered by the member's PCP or attending physician as follows. Inpatient PT services are covered for all members who are receiving inpatient care at a hospital, nursing facility, or a custodial care facility. Outpatient PT services are covered for members under the age of 21 when medically necessary, and outpatient PT services are covered for adult members 21 years of age and older. PT services are provided by a qualified physical therapist or by a qualified individual under the supervision of physical therapists within their scope of practice and consistent with ARS Title 32, Chapter 19, and Arizona Department of Health Services Administrative Rules for Arizona Administrative Code Chapter 24. Outpatient PT is not covered as a maintenance regimen. Authorized treatment services include, but are not limited to, A, the administration and interpretation of tests and measurements performed with the scope of practice of PT as an aid to the member's treatment, B, the administration, evaluation, and modification of treatment methodologies and instruction, and C, the provision of instruction or education, consultation, and other advisory services. And if you like some resources, please check out the Access Medical Policy Manual, specifically Chapter 310X on occupational, physical, and speech therapies. We also have the Access Medical Policy Manual, known as the AMPM, and I can show you where that is located on our website. To find the Access Medical Policy Manual on our website, go to our main webpage at www.azaccess.gov. And on the burgundy toolbar, please select the Plans and Providers tab. And on the left-hand side of the menu, scroll down to Guides, Manuals, and Policies. And towards the middle of the page, you'll scroll down and click on the Access Medical Policy Manual. And then scroll down further and click on Chapter 300. And then click on 310 Covered Services. And then scroll down to 310X Occupational, Physical, and Speech Therapies. This will bring up that specific chapter in the AMPM manual. And if you have questions at any time, please feel free to outreach the DFSM provider training team at providertrainingffs@azaccess.gov. And thank you so much for joining me today.